Thank you, Pastor. I was not expecting to speak today, but I'd like to tell you a story about a very good friend of mine, Jim Cleary. I first met Jim back in the mid-1970s. He was organizing laundry workers in Madison, people who had very, very low-paying jobs and no benefits. There was something about Jim that was magnetic. He had a way with people. He cared about people. He especially cared about the little guy and helping folks out that didn't have the means to help themselves. Jim fell on hard times in the 80s, and for about 20 years kind of bounced around from one minimum wage job to another. None of those jobs had health insurance. And as a result, he was also not eligible for any kind of government program, wasn't eligible for Medicaid. And as a result, he neglected his health, wouldn't go to the doctor because he couldn't afford it when he didn't feel good, didn't go in for checkups because he couldn't afford it. He finally got a job 3 years ago. Not a high-paying job, but a job that did have health insurance benefits. And the first thing he did was to go in for a physical. He found out that he had prostate cancer. Prostate cancer that was so advanced that there was nothing they could do. There was no way to treat it. Jim died a year later. Jim died because of the dysfunctional healthcare, quote-unquote, system that we have in this country today. Because people like Jim don't have access to healthcare and don't have access to not just emergency care, but to the basic kind of preventive care that helps to keep people well. If Jim had had health insurance, he would have gone in for that checkup. He would have been diagnosed with that prostate cancer early enough to check it. I've had prostate cancer. I've had good insurance. And my prostate cancer was caught very early, and that was 14 years ago. But if I had not had health insurance, if that had not been diagnosed early, I wouldn't be here today. Under the kind of health insurance reform that's being talked about in Washington today, Jim Cleary would have been covered, because this system would not only have provided him with access to quality health care, but it would be under a system that emphasized preventive care and wellness and keeping people from getting sick in the first place. Jim Cleary is no longer with us to tell his story. And that's a tragedy, because Jim was a good guy.